Okay, I'm glad you're here. Don't leave. We need to talk about something really important. And that's the question, how do you know you're doing therapy the right way? I recently was scrolling Facebook in a therapist group I'm in, and I saw a young therapist asking this very question. They were looking for advice and some feedback and genuinely curious, how do I know I'm doing therapy, quote unquote, the right way? How do I know I'm doing it correctly? How do I know I'm doing good therapy? And these are all really important questions that I think we need to be able to answer. And I don't think there is one clear answer either. And so I'm going to break it down in this video. I compiled a list of the most common responses that were left on this person's post. I'm also going to give you my take as well as we go through. And for you, if there's anything that you feel like you want to add to this list or that's not on this list, make sure you leave that in the comments below so we can start a discussion about that. Okay, so how do you know you're doing therapy the right way? I mean, I think this is generally a really good question that I don't really see a lot of people asking, but it's one that really needs answering. And obviously, I think I can speak for everybody. We want to make sure we're doing it, correctly. We want to make sure we're doing it the right way, right? We want to make sure we're doing good work. But therapy is oftentimes just between me and the client. I'm not sitting in a room full of people who are observing me, and there's not a specific textbook that says you need to do it just like this, and there's a formula for this, and this is exactly what that breakdown looks like. And yet, even though this isn't a math problem and there's not a right answer, there does seem to be a general consensus of what makes good therapy or how you know you're doing it correctly. So I've compiled a list of the most common responses that I saw. Let's go through this and see what you think. I do want to say that the posts were pretty divided. There were a lot of people who say you don't know. This is just part of being a therapist is you just don't know. And then a lot of people were in very much agreement that yes, you absolutely do know. There's some pretty clear indicators that you're doing good therapy or doing it correctly, which I found interesting that there seemed to be such a divide where some people were like, this is so nuanced, you really don't know, it's so subjective, you're just winging it. And then other people saying, no, you absolutely do know. And there's lots of different examples of what that looks like. So let's talk about some of the most common responses. The first one was clients feel understood and safe to share. I thought this was such a good comment because, yes, absolutely. If a client comes to therapy and they feel safe, they feel like that they can trust you, that they can open up to you, yeah, that's a good indicator that you're doing something right and that you've created, at minimum, good rapport or a safe environment for the client to feel like that they can trust you and they can talk to you, which as therapists, we know that if someone's not feeling that way, then we can't even begin to do good work. And we can't even begin to use all the knowledge that we have to help them. So this really is one of the foundation pieces, I think. And absolutely, I agree with this post. If a client doesn't feel understood, if they don't feel validated, if they don't feel like that they can share, then it's probably going to really limit you in the therapy you can provide. And even if you're a very well seasoned, highly trained therapist, if a client doesn't feel that way, then they probably are going to say, I don't feel like it was a good fit for me. I don't think it was a good therapist experience. I don't think it was good therapy. So how they feel absolutely is so important. Another response was clients keep coming back to therapy. I saw people say that a lot. Like if they keep coming back, then something must be quote unquote right. Something must be working. And I definitely would agree with that sentiment that if you have someone who consistently comes back and they want to work together, then that's definitely an indication that something's right, something's going well, and that they feel like it's helpful or beneficial because if not, why would they come? I mean, unless they're court ordered, which the post didn't really talk about. So I think maybe that would be a caveat is like if they're being mandated to come, then maybe you wouldn't use that as a judge of whether or not you're doing it right. But I think for the general census of people voluntarily coming to therapy on their own and willingly, and they want to continue to come and come back, is definitely an indication that something is going well. In line with that, there were several posts about few no shows. And um, I feel like this is debatable because I don't think that someone's attendance or having perfect attendance equates to you providing good therapy or you doing therapy right versus wrong. I mean, there's a lot of reasons that someone might choose to miss therapy, that they might have spotty attendance, that they might struggle with attendance issues. We talked about that in a recent video I did about addressing attendance issues. So if you haven't seen that, make sure you go look that up. But I don't think that that necessarily is something I completely agree with. I'm just thinking about like populations that would struggle with attendance, but wouldn't necessarily say in the same breath that they don't feel like it's helpful. And if you are working with a population who, well, there's a lot of examples. So if you're working with a population that struggles with attendance because they have car issues or they're low income or they have difficulty getting childcare or they have constant work schedule conflicts come up because they pick up a lot of extra shifts or their work schedule is changing constantly. I mean, all those reasons might be indications that someone would not come to therapy or they would no show or they would miss an appointment, but wouldn't mean that you aren't providing good services. I'm also thinking of people who maybe struggle with follow through, they struggle with time management, they struggle with remembering things for one reason or another. And again, all reasons that someone would no show, but I really don't think that your no show fee can equate to whether or not you're doing it right. I think a lot of therapists out there are doing really, really good work, and you still have clients that just don't show up. And I myself have seen clients tell me, like, hey, this is really helpful for me, or last session was really helpful. Thank you so much. And they still struggle with attendance or they have to cancel, or sometimes they forget about it and they don't show. But they're not necessarily saying that I'm not showing up because this isn't helpful. So I don't agree with that one, but I'm curious what your take is. So leave that in the comments below. Another thing that I saw pop up a lot was people, past clients, colleagues are referring to you. And I definitely would agree with this in some way. Put a little asterisk there, right? Like, I definitely think that if people refer to you, that means that you're probably doing therapy well, you're doing good work, you're doing it right. Because why would people trust you enough to refer to you if they didn't feel like that you were doing good work? And same with like past clients. If a past client was like, oh my gosh, that was terrible therapy, then they probably aren't going to use you as someone that they would recommend. So I think yes, but what kind of trips me up there is I don't think that's a blanket statement because you might be a great therapist and you're doing really good work, but you just don't have your name out there a lot yet, or you're newly starting out and you don't have maybe a lot of time to invest in marketing, or you're getting a lot of referrals from maybe like Psychology Today or another online directory versus word of mouth. And so your lack of referrals from people or past clients wouldn't necessarily mean that you're not doing good work. It could be for a variety of reasons. So yes, I think if people refer to you, that's a good sign, and you could still be doing great work and doing it correctly without there being a lot of referrals coming from word of mouth. And so that's where I feel like there's a little pause there for me. I'm like, I think it's kind of like a yes and no. Now, some people were saying that they rely more on the quantitative or like the numbers and statistics side of measuring this, or like a reduction in symptoms. And so let's talk about that for a second, because I definitely think that that's an important piece here. One of the more common responses was a reduction in symptoms, specifically using measurements and screening tools to quantify this. And I definitely agree that that is something that is probably a really good indication that something's working well, because if you're coming into therapy and you are scoring really high on the GAD-7, for example, and you're in like, the high teens, maybe you're at the top of the chart there at the, low 20s. And then several months later, we're looking at a reduction in symptoms and maybe you're scoring like a 7. Then I would say absolutely, you're probably doing something right. Things are going really well because they've had a massive reduction in symptoms. So yes. And another caveat here, I think you could be doing really good therapy and also they might not have a reduction in symptoms. So, for example, if you have a client who has maybe treatment resistant depression, or they seem to have just like very persistent depression for one reason or another, or they have a lot of life stressors or new things that pop up on top of what they're already dealing with when they're in therapy, then you might notice where even though things seem to be going well, they're giving you good feedback, they're still having a pretty high like acuity in terms of symptoms. They're scoring really high and they're having pretty intense symptoms. And so I think this is another one of those things for me where I'm like, yes, quantitative wise, if you measure a reduction in symptoms and you see a reduction in symptoms, then I would say something's going well. And just because you don't see that doesn't mean that you're not doing it right and things aren't going well. There could be a number of other factors that are influencing their symptoms. And I also would want to know, like, well, how frequently are you measuring this? How long has it been? what does the effort look like on their part? Are they in any other treatment? Are they on medication as well? Like, I just feel like there's so many other factors to it. So for me, that one's a yes and no. And I don't feel like there's just like a hard and fast rule of if your symptoms are reducing, then you're providing good therapy. I think you can absolutely that be the true. And also, I think you could still be doing really good work and doing it quote unquote right, even if you don't see a massive reduction in symptoms. I'm curious what you think about that. Let me know in the comments below as well. A lot of people also said client feedback, and I think that is one of the easiest ways and quickest ways to figure out whether or not someone is really finding therapy correct or really finding therapy helpful, or they feel like that you're doing it quote unquote like the correct way. Because if a client says, yes, that was so helpful, or thank you so much, I felt like last session was such a breakthrough for me, and someone else made the comment like if you're doing treatment reviews and you're seeing like people are saying yes, like that was helpful, or I've reached my goals, that all of this would be good feedback that would indicate that you're probably doing it right or quote unquote correctly. I definitely think that this is something that is true, because a client's subjective report, I feel like, is the most important piece of therapy, because regardless of all the tips and tricks I might have and the interventions I'm using and all that stuff, if you as a client don't feel like that it's helpful, then it's not going to be helpful. And that's what we need to go off of versus everything that I'm doing. So I definitely agree with this. And I really encourage you to be soliciting feedback from your clients, even outside of doing like treatment plan reviews and talking about like reaching goals and progress. Because if you are working with a client and you're going to say, hey, maybe you should try this, coping strategy, or hey, let's talk about this, or even just starting out session as a bridge between sessions and going, tell me what you found was really helpful for you last session. That can be a really good indication as a therapist of like where we need to go from here, what seems to be helpful, what do I maybe need to explore more, what maybe wasn't helpful, so that I'm always staying up to date on what it's feeling like for the client and guiding treatment to fit with what they find helpful. So I would definitely be soliciting that feedback even outside of treatment plan reviews, but both of those can be helpful ways to get the client feedback if they're not just soliciting it on their own. And in line with them soliciting it on their own, some people were saying when clients say certain things like, I've never thought about it that way, or they verbalize excitement to meet because they want to share something, that those are good indications that therapy is probably going well or that you're doing it right. And I definitely think that those things can be really, really helpful, because if you are getting the client to think about things from a different perspective, or you're getting them to learn new coping strategies and to support change and growth, then you are definitely doing something right. I think that that is the purpose of therapy. And whether clients say that outright or not is going to depend a lot upon the client. But if they are saying it, I definitely think that that is definitely a good indication that something is going well. There were also a lot of responses about therapists just using empathy, compassion, and being authentic. And I hope that everyone is doing that. I think that that's, a lot of what makes a good therapist. It makes you trustable and relatable, and makes you, like I was saying earlier, just have this aura about you where you're like, I'm creating this like safe space and you feel comforted and you feel like you can talk to me about things. Again, I don't think that that's a hard, fast rule of like, if you're being authentic and kind and compassionate, that that necessarily means you're doing good therapy. But I definitely think that those are kind of like the bread and butter to making sure that you are moving in the right direction and that you're providing good work and that you're least likely to do any harm. Someone else said clients doing better slash reaching goals. And that could look like needing to meet less frequently or even no longer needing therapy. And yes, 100%. I definitely think that if you see people who start to say, like, I'm starting to feel better, or I feel less anxious, or I'm feeling less depressed, or more motivated, or more confident in myself, like whatever that might look like, that's a really good indication that you're probably doing good work and that therapy is helpful and it's going well, because they are feeling the impact of the services and they're feeling a noticeable, like, positive difference, which I think I can speak for everyone when I say like we want that. That's good. That means that something is going well. So I agree with that sentiment. Like, absolutely. If you see a client that seems to be doing much better and they say things like, I'm feeling differently, I'm thinking about things differently, I'm having less symptoms, I'm less anxious, or they say things like, I feel like I'm in a good place, that's a really good indication that therapy has been going well, you are doing things well, and that it's going right in the client's eyes because it's helping them reach their goals and maybe even getting to a place where they don't need therapy anymore, or they feel like that meeting less frequently still is good for them because they can kind of check in, but they don't feel like that they need that support as frequently. And someone else said getting positive feedback from supervisors. And I thought this was really interesting because a lot of us don't have that. I myself, I own my own practice. And so I don't have a supervisor telling me, like, hey, you did really good with that client there. But if you do have a supervisor who is maybe, looking in on sessions and sitting in on sessions every once in a while, or you work in a setting where there's maybe also groups and they're watching you and observing you kind of run groups, or they're also having interactions with clients and they're seeing clients, who are saying like that was really helpful, or I feel like it's going really well, or I really like my therapist, it can definitely be an indication that things are going well. I feel like it's always naturally just a good feeling when a supervisor or a colleague or someone is able to look at you and go, good job. Like, and I hope you're getting that. I know that not everyone does, which sucks. And it doesn't mean that you're not doing good work, but it definitely can feel really good when someone says, hey, I noticed you did X, Y, or Z, good job. Or, hey, that client said X, Y, or Z, you're doing a great job. I just wanted you to know that, or I wanted to share what they thought about the session with you since they shared that with me. So supervisor feedback can definitely be an indication that things are going well or that you're doing it correctly. But a lot of the results I felt like were still pretty nuanced. I just felt like that a lot of the responses in that list are, while they make a lot of sense, I think it also is just not able to be a blanket statement of if you are empathic and you show positive regard and you have a client that says that things are fine or they don't need therapy anymore, that means that you're doing good work. Like, I think there really is a lot of nuance to all of these answers, and some of them I think we can take at a pretty clear indication of like, yes, things are working. And then sometimes I think that some of the responses could be, well, yes, and also it depends. It doesn't mean that if you're doing that and that they're not improving, that means that you're not doing good work, because a lot of what happens in the therapy room is something that we don't even realize as a therapist, right? Like, it's their perspective, it's their assessment, it's their subjective experience. And so I could leave a session and be like, hell yeah, that was a great session. I thought there was such a breakthrough. And they might have a totally different take on the session, and vice versa. I have left sessions before and been like, I don't really know. Like, did anything stick? Did it land well with them? Could I have used a different approach? And then they've come back and been like, oh my gosh, that was so helpful. And I'm like, oh, what did I say? Right? Like, I don't really remember. Like, did I say that? Was that helpful? Like, and I sometimes have clients who tell me, like, I remember when you told me this and it's been weeks ago. And I'm like, I don't remember me specifically saying that. I remember us kind of talking about it, but clearly it stuck out for you and not me. And that's the most important piece, is that it stuck out for you and it was something that was helpful for you. So it really is all about their experience. We might be like, oh, that was terrible. And they might be like, that was a great session. Or we might be like, that's a great session. And they could be like, I don't know, it was just okay. So really, I think the best way to know whether or not you're doing good therapy is really looking at a combination of all of these things and the client's general feedback and consensus of what they're finding to be helpful or not helpful, because it really is about them and their experience. And research has shown this time and time again, that what makes good therapy is largely based off of the working relationship between the therapist and the client, not about the therapist credentials or how long they've been practicing, or all their specific trainings. Like, it has way more to do with the client and the client's subjective experience in therapy. So, all that to be said, you can be doing great work and doing it correctly and not even realize it, because your client might not be telling you every session, that was great, that was helpful, but they're still showing up, they're still coming, they're having a reduction in symptoms. And so I think we can say, yeah, like, something is clearly working. So it's such a nuanced question. I just feel like that it depends. But if you're noticing a lot of these signs, then I think it's an indication that things are probably going well. And there was a couple of big, like, key takeaways from the responses that I saw, and I wanted to share those with you. Um, Someone said the proof is in the pudding. And I agree with that so much, because if you're seeing these things pop up, you're seeing clients keep coming back and they want to do the work and they are saying that things are helpful and they're continuing to show up and they're having a reduction in symptoms, or they're just continuing to show up despite reduction in symptoms or what have you, and you're seeing all of this proof that something is working, I think you can go ahead and give yourself a pat on the back and say, like, I'm clearly doing this well. And someone else said, which I really love, they said, don't focus on right versus wrong. Simply aim to help clients' lives become better. And I love that so much because I really hate when we are trapped in this box of like, am I doing it right? Because I think that that implies that if you don't, then you're doing it wrong. And it's just putting us in such a box. I think that there are so many ways to do therapy well and to be a good therapist. And there's so many different client experiences that we're going to notice that all indicate that things have gone well. And you might have a client that's like, I just didn't find that helpful. And that isn't a hard and fast rule that says, well, you're not doing therapy correctly or right. So I really like this idea of let's not aim to do it right or correctly. Let's aim to help meet them where they are, be empathetic, be compassionate, hold space for them, help them reach their goals, and help them even feel like 1% better. Because if we've been able to do that, if we've been able to make them feel supported, less alone, or that they can talk to somebody, in my eyes, you're doing it well and you're doing it the right way and it's working out clearly because you're creating a safe space for them, even if they don't reach their goals, even if they stop coming, all these other factors that you really don't have a lot of control over. So I hope the takeaway from this is one, there's a lot of nuance to this, there's a lot of opinions on this. But overall, I think it's pretty clear that if you are able to really look at your client and see that, hey, they're showing up and we have a good relationship and they feel safe talking to me and things seem to be working in some degree, then I think we can say, yeah, you're doing a really good job. I really do think that we are all doing good work for the most part. And that if you are showing up and you're giving 100% and you are being empathetic and compassionate and you're willing to learn and you're willing to take feedback from clients and continue to work with them, then you can give yourself some grace and say, okay, I'm probably doing a good job. I'm interested to hear what your take is though. So please make sure that you are leaving that below in the comments. And until next time, bye.